How does HPV affect men's health and cause cancer? Human papillomavirus, or HPV, is one of the most common sexually transmitted infections worldwide. While many people associate HPV with cervical cancer in women, it also plays a significant role in men's health. Understanding how HPV impacts men involves looking at the types of HPV, how it spreads, and ways to prevent related health issues. Certain high-risk types of HPV, especially type 16 and 18, are known to cause cancers in men. These include cancers of the penis, anus, and parts of the mouth and throat, known as the oropharynx. Research shows that more than 90% of anal cancers and most penile and oropharyngeal cancers are linked to HPV infection. Men with multiple sexual partners, men who have sex with men, and those with weakened immune systems, such as individuals living with HIV, are at higher risk. Most HPV infections do not cause symptoms and are cleared by the immune system within a couple of years. However, persistent infection with high-risk HPV strains over time can cause cellular changes that may develop into cancer. There is also emerging research suggesting a possible link between HPV and prostate cancer. Some studies have detected high-risk HPV DNA in prostate cancer tissues, indicating that HPV might be a risk factor, although more research is needed to confirm this connection. It is important to note that current evidence does not establish HPV as a direct cause of testicular cancer. Still, men with testicular cancer, especially those undergoing treatments like chemotherapy or radiotherapy, tend to have higher rates of HPV found in semen. This may be due to treatment-related immune suppression, which can make the body more susceptible to infections like HPV. Testing semen for HPV before and after treatment can help monitor potential impacts on fertility and overall health. Unlike women, men do not have routine screening tests for HPV or HPV-related cancers. Usually, diagnosis occurs when visible symptoms appear, such as genital warts or lesions on the penis, or symptoms related to cancers in the anal or head and neck regions. Symptoms might include persistent sore throats, lumps in the neck, unusual bleeding from the anus, or changes in the skin on the genital area. If you notice any unusual symptoms, it is important to see a healthcare professional for proper evaluation. Prevention is key when it comes to HPV. Vaccination against HPV is highly effective in protecting against the most common high-risk strains associated with cancer. The vaccine is recommended for boys and young men, ideally before they become sexually active, but it can also benefit older men. Consistent condom use during sexual activity can reduce the risk of HPV transmission, though it does not eliminate it entirely because HPV can infect areas not covered by condoms. Since many HPV infections clear on their own, vaccination and safer sex practices are essential strategies to reduce the risk of HPV-related cancers. In summary, HPV affects men's health mainly by increasing the risk of cancers in the penis, anus, and mouth and throat. While it is not directly linked to testicular cancer, the infection can be more common in men with testicular cancer due to treatment effects. Raising awareness, getting vaccinated, and practicing safer sex are important steps to protect against HPV and its associated health risks. Always consult healthcare professionals for personalized advice and screening options to stay proactive about your health.